Hello everyone, I am Sahana, Child Psychologist, Maarga. As you already know the early symptoms and signs of autism, let me tell you what are the processes which involve to identify or to assess the children in our hospital. First, if the child comes in, we will try to identify the child's presence and the severity of the condition through assessments. The psychological assessments will also help us to rule out any comorbid condition. For example, if the child has an intellectual disability or any other conditions. For that, the psychological assessment is very much important. The very first assessment we do is the IQ evaluation. We are identifying the developmental age of the child, we are identifying the intelligence of the child, or we are identifying the social development of the child based on the child's need. That will give us an idea that the child has any difficulty in the cognitive part. Once it is clarified, then we will understand that this is only the autism we are looking forward to, or is there any comorbid condition. The developmental assessments will help us to understand the level of severity, the presence of severity, and the cognitive level of the children. And this kind of assessment will also help us to guide through the process. The second assessment what we do is to rule out the ADHD or any kind of inattention and hyperactivity in the children. A lot of times autism can be presented like ADHD. A lot of people, the developmental assessments will help us to understand the level of severity, the presence of severity, and the cognitive level of the children. And this kind of assessment will also help us to guide through the process. The second assessment what we do is to rule out the ADHD. The next assessment what we usually do is the behavioral assessments, which will help us to identify the children's different clinical behaviors or what are the problems which can come out from the behavioral issues, and which will also help us to identify whether the behavior is externalized or the child is showing in the behavior in a different form, which will help us to customize the process. The very important assessment is the scale where we identify the presence and severity of the autism, which involves different areas in the autism spectrum disorder, which will help us to understand the complete picture, where we identify where the child starts in and what is our goal to go forward when we start the treatment process, which is the benchmarker for us to work on the further things. A lot of times the children comes with the anxiousness, low mood, or the crying spells, especially the adolescents. When we look into the history of it, or when we explore that, it is also because of the neurodivergency which is present in the children. So when there is a comorbid condition, which is the neurodivergency, as well as the anxious episodes or the mood disorder or any kind of behavioral or thought difficulties, it is very important for us to identify that the presence and severity of the clinical conditions such as anxiety or low mood or crying spells or self-harming thoughts. So we do assessment to identify which stage the child is in this particular areas or in those particular conditions. Autism spectrum children faces a lot of anxiety issues, low mood or crying spells or negative thoughts because of the difficulty which is happening because of the social communication difficulty they already have. So to rule out or to identify the presence and severity of those emotions or the thoughts, we also do the psychological assessments for anxiety test or mood test, so that we can address both autism spectrum disorders as well as anxiety and the mood thoughts. When the required assessment are over, we'll prepare a detailed report and individual intervention plan which can be helpful for the child for their process.